Hello everyone, welcome to another episode of Health Tech with Purpose. Today we have Marco Foracchia joining us on our show. Marco is the CIO of Reggio Emilia Local Health Authority, which is a network of 6 hospitals in northern Italy that comprises the public health and all the outpatient infrastructures including social care. Join us on this exciting episode where Marco shares his views on creating a nationwide electronic health record system to invest in public health and outpatient of hospital care and to develop a network of smaller community hospitals.
Hello, Marco. How are you today?
Hello. I'm fine. Thank you very much for inviting me. Great
Yes,
to be
pleasure
here
is
with
all
you.
us. Yes, pleasure
Yeah.
is all us. Thank you so much for taking out the time. And as we get started, why not we get to know a bit of an introduction and background about you? So, right from you. So, go ahead, please introduce yourself.
Okay. I'm the CIO of the Reggio Emilia Local Health Authority, which is basically a network of 6 hospitals in northern Italy. Reggio Emilia is a town located halfway between Milan and Bologna, for those of you who are familiar with Italian geography. And the local health authority, of course, it comprises also the public health and all the outpatients infrastructures, including also social care. So it's a very diverse and very articulated healthcare environment. I'm part of the Emilia-Romagna regional healthcare system, as probably some of our listeners are familiar with. Italy is divided into 20 different regions, and every region has been autonomous with respect to many different aspects, including healthcare. Therefore, every region has a different healthcare system in a way, in terms of management, in terms of development, in terms of actually also the digital strategy.
Great, great. Good to know. So, Marco, tell us more about the recent changes in the Italian healthcare space, especially for hospitals. What kind of transformations the hospitals are currently looking into?
Well, the pandemic has been a major change in the overall healthcare strategy and the digital healthcare strategy at the same time. What happened is, first of all, after the COVID pandemic, we received a significant amount of funding, what's called the Recovery and Resilience Program, which is funded by the European Union. So this major wave of funding also brought with it a new national level strategy with respect both to healthcare in general and to digital healthcare. This is new because, as I was telling you, Italy had always been divided into 20 different regions with respect to all aspects related to healthcare. Suddenly, in the post-COVID experience, we started to see programs at the national level. And so this has been a major change. One of the major programs is actually the development of a nationwide electronic health record system, which is a very challenging and very ambitious project. And this project basically wants to bring up the experiences of some regions, especially in northern Italy, that had developed at a regional level and a unique healthcare electronic healthcare system, and bring it to a national level. So basically, the new wave is trying to leverage positive experiences from the different regions to a national level. At the same time, the major policy in change in terms of healthcare, which affects, of course, digital healthcare, is the development of what we call beyond hospital healthcare, going outside of the hospital. So most of the funding, a significant amount of the funding coming from the Recovery and Resilience Program, is focused towards public health and out of the hospital health, including at-home care, including social care, including telemedicine, of course. So, and this is something new because most of digital healthcare in the past had been focused mostly, if not only, on the hospital. So we're going beyond the hospital. And this is a major change from many different aspects in terms of organizational change, but also in terms of cybersecurity, if you think about it, because suddenly we had reached some sort of a comfort zone, a very difficult and dangerous comfort zone, which used to be the hospital. Suddenly now we are forced to actually go beyond the hospital, which means basically increasing the risk in terms of cyber security enormously. So there are many challenges brought by this new wave of changes.
Right, right. And I think you touched upon a lot of pointers. So maybe let's dig a bit deeper into some of them. Let's start with the recovery and resilience program. So for the for the people outside of Italy, for example, or outside of Europe, can you give a bit more context about this program, what it entails, what is the purpose of it, and how it impacts the health ecosystem?
Well, the Recovery and Resilience Program stems from the experience of COVID, and basically every single aspect of it comes from some aspects that have been shown during COVID not to work. The major being the fact that the different regions, the 20 different regions in Italy, coped with COVID in a very different way. Some were more advanced, some were less advanced and less organized. So one of the key aspects of the Recovery and Resilience Program is to have a nationwide program that should, we'll see how it will go because it's ongoing right now, should basically level up all the regions with many different, with respect to many different aspects, including digital healthcare. And some aspects are related with the fact that there was very little inter-exchange of information between organizations during COVID. And that's where actually the idea of having a unique nationwide electronic health record system comes from. The idea that all different organizations, mostly public, but not necessarily, the Italian system is mostly public, but we have a significant part of the healthcare system, which is private and growing actually. And all these organizations should actually bring their information at the national level in order to have the patients basically migrate to the different regions and through different organizations and bring their healthcare information with them. It's not a new idea. We've been talking about this for the last 20 years, but in Italy, they're actually doing it, leveraging experiences of some regions, especially in the north, and trying to do it so that in case of a new pandemic, but also for the regular times, I mean, patients can actually be travel around the healthcare ecosystem, both public and private, anywhere in the geography of Italy, and bring their information with them. This project is also connected towards a European perspective. Some of you might have heard of the European Healthcare Data Space, EHDS. That's a major project. And if you think about it, the National Electronic Health Record is nothing but the Italian little bit of the overall European system. So the National Electronic Health Record, the Fascicolo Sanitario Elettronico, that's the name of in Italian, will be the actual source of information for the European healthcare data space. So this project is in line with the overall European perspective, the overall European project. So this line stems from the COVID. Another aspect that actually came out of the COVID experience is the fact that our hospitals were probably, especially in northern Italy, but roughly around all of Italy, they were ready to cope with regular healthcare business. But as soon as a major wave of COVID came, they collapsed. That's something that has happened all over the world, but in Italy, especially, as you remember, northern Italy was one of the first epicenters of the pandemic. And this showed basically that the hospital was the first frontier, and that's something not normal. I mean, patients had to be taken care of before they got to the hospital in order to make it possible for the hospital to survive, actually, and just to take care of the most acute patients. So this has basically taught us a lesson which we had already been telling. If you think about it at conferences like 15 to 20 years ago, we've always said that the primary care, public health is the first frontier that should manage most of the healthcare. And finally, we are now doing it. So we are putting a lot of investment and a lot of effort, both in terms of organization and digital infrastructures, in the general practitioners, general care, and the public health system. This both in terms of digital, but also physical infrastructure. In Italy, we are building many different smaller infrastructure, or community hospitals like you do have in the UK. We never had those. Healthcare centers for outpatient outposts spread along the geography of the different regions in order to have the hospital be mostly focused on acute care and bring everything that can be brought outside of the hospital outside, both in terms of infrastructure, building actually organization, having professionals work there, and at the same time, a digital ecosystem, which has to be, of course, all connected with the hospital and at the national level. So the Recovery and Resilience Program is basically a major funding that goes into many different aspects. Physical buildings, technology, buying a lot of technology also in terms of medical devices to actually provide this new structures with basic technology. Organization, building up new type of professionals, new type of doctors, new type of nurses that actually will work in these new environments, and digital infrastructure everywhere to get everything connected.
Right, right. Makes sense. And we have, of course, heard this before, like, countries like US or even in India, like very large countries, as well as other countries in Europe, for example, France or Germany, they're all say trying to unify systems, be able to provide continuity of care between hospital to home, and health equity is a big thing today, to be able to provide this access to each and every person. As a CIO who is seeing all of these changes happening, can you share some of the best practices that you are probably bullish upon, that this is really going in the right direction, and if possible, any challenges that you would like to also point out that you foresee happening as this change is happening?
Well, it's bringing this ecosystem to be connected is something that from a technical point of view is solved. I mean, we have standards, we have networking infrastructures.
We have something similar to like fire, like what kind of what
exactly. I mean, fire it's fairly stable and commonly used. We have had HL7, other versions of HL7 in the past, so it's not a technology issue. Building a connected digital ecosystem for healthcare is a matter of actually planning it and having all the stakeholders involved in it from the bottom up. Okay, one of the major issues that is coming out of the Recovery and Resilience Program is that it is a top-down approach. It comes from the national government. We are establishing a national electronic health record. Now everybody has to pump information into the electronic health record. And this information, of course, is all on fire, because of this being a new project, it's all fire-based. So from a technical point of view, it is possible, it is perfectly feasible. The only thing is that you have to get down to the bottom of the overall ecosystem, which means all hospitals in Italy, starting from the very large research institute, like we do have it here in Reggio Emilia, but also the small hospital up in the mountains. All these structures have to suddenly be willing and able to actually integrate their local ecosystem towards an ecosystem that is outside. This requires a lot of management from the colleague CIOs at every different level, because you have to think about the fact that all these structures have been independent for the last 30 years, basically, in terms of development of their digital ecosystem. So suddenly opening everything to a general view is something that is not always that easy, because there are infrastructures that are ESB based, they have their own electronic medical record, very advanced. So it's fairly easy to actually scale it up and ship all the information to a higher level, fairly easy. There are structures, hospitals out there in Italy which are very behind in terms of digital development. They have independent silos. They have absolutely no local MPI to actually refer to. They do not have interoperability within their organization, and suddenly they're required to actually ship information to a higher level. So the main challenge that we're actually facing is that from the top down, they are building a unique infrastructure. They're forcing everybody to have a unique electronic health record system to get a uniform situation all around Italy, not taking enough into account the fact that all the different bits and pieces, all the different leaves of this giant tree, all these different hospitals and local healthcare organizations have developed in a very different way. Some are very mature and can easily connect to this. Some are extremely immature and they never actually reached the local interoperability level. So it is what's happening right now is, of course, that major organizations, major hospitals are actually joining the project fairly easily, and we're getting a fairly good success in terms of data actually gathering on the national platform. But of course, reaching all the areas of Italy and all the different sizes of organizations is something that is proving to be very challenging. Okay, so the risk behind it is to have a major infrastructure that is just merging the major organization and not the little leaves. And the little leaves, the little hospitals, are those that were actually should have been the more active in managing the pandemic.
Them to be more organized.
So probably we're missing the point from many aspects. But being a very new project actually has to be, of course, fine-tuned in the ongoing development.
This episode of Health Tech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to Health Tech with Purpose. Make sure to subscribe us on Spotify, Apple, and YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
Okay. So since like you anyways mentioned that it's something that is coming from the top, so is there any legislation incentivizing or putting fines against a certain date that everybody has to say, follow this timeline? Like what kind of push the government is making to enable this?
Well, of course, there is a national legislation for this, especially because all this project requires, in terms of privacy, in terms of data management, personal data management, it requires a national legislation to actually take care of all the appropriate measures in order to be sure that no citizen is compromised in their privacy of their data and their ownership of their data. Therefore, there is a national legislation. This legislation was actually has been in place for several years, and the Recovery and Resilience Program basically gave the fuel to actually get the project starting, which is the funding, basically. So the key behind it is that we are all required to actually connect to the system, and in order to receive the funding, which covers all of the different aspects, including buildings, including organization, including improving the local digital healthcare, we have to connect to the national healthcare electronic health record. Therefore, there are no real fines, but if we want to get the money to actually get everything else done, then we need to ship the information there, and we have KPIs to reach by the end of next year, by the end of 2025. Therefore, the national legislation has put it this way: you have to do it. If you want money to actually reconstruct and rethink and revise all the digital ecosystem of your organization. We will give you money, but if you accept this money, then you have to connect to the national electronic health record. So it's on paper, it's a win-win situation. We win because we receive funding to actually restructure the local organization, digital infrastructure, and at the same time, the national level wins in the sense that we will be required to ship our information to the national level. So on paper, it should work.
Makes sense. So, coming to another aspect that you had touched upon, Marco, is since now this change is happening, I believe any disruption opens up opportunities for new companies or old companies to be able to participate. And I know there are so many digital health companies that want to build and participate in this revolution. So, can you shed some light around what are the kind of opportunities that exist for, say, larger companies, but more importantly, smaller companies that would, let's say that's a startup that wants to change health? And one, what kind of opportunities? And second, how they can participate. So is there a path to it, or is it something that they have to reach out to each and every hospital separately, or is there some sort of marketplace they can look into, like placing themselves or to get an audience? So how is that whole startup ecosystem getting fueled in health?
Well, the whole national resilience, reconstruction and resilience program has been based on a national procurement process. And this was not really good for startups and small companies because, of course, once you get a procurement process from the top national institutions, of course, they tend to actually stick to the big players. Nevertheless, these big players suddenly were overwhelmed by the amount of projects that they needed to actually to implement. Therefore, they are currently involving smaller companies to actually help them build all these new infrastructures. Because you have to think about the fact that you have the top level, which is the national electronic health record, but at the same time, in order to ship information up there, with many organizations are actually restructuring the basics, MPIs, electronic medical records, laboratory system, PACS system. There's been a major wave of actually renewing all the systems or building or getting new systems from scratch because many organizations did not have an EMR system, and so they're building that from scratch. So what's happening basically is that the four big players, because in Italy we have four big players in the healthcare market, in the digital healthcare market, are actually joining with minor, smaller companies that actually help them actually implement these projects at the local level. So this is the situation with respect to the current market. The nice part for smaller companies is that suddenly something new is opening up, because part of the side effects of the reconstruction and recovery program is actually the fact that telemedicine is exploding, exploding in the sense that we have a lot of funding for telemedicine. And telemedicine, of course, is at the frontier. There are many small companies that are offering new solutions. So that's probably a great opportunity for these startups or companies that are actually improving their existing systems and scaling them up at the regional or national level. And at the same time, having finally an interoperable national level or even at the regional level, merging of all information suddenly opens up really the business intelligence and data analysis field, which we've always spoken about it. We've spoken about AI possibilities in the future. We could do this, we could do that if we had all access to all the information. Suddenly, we do have access to all the information, and it's building up a huge repository of information, structured information, because the general project is based not on PDFs, it's based on actual structured information that we're gathering. And so suddenly there's really a huge market opening up for real medical information analysis, which ranges from simple BI tools up to extremely sophisticated AI AI systems that could be implemented. So that's a huge market that is opening and will probably be exploding in the next few years, because suddenly these projects basically build the building blocks of real medical information processing at a large scale, not at a single organizational level. So this is really a great opportunity that is opening up for startups and innovative companies.
Right, right. No, well said. And definitely, like I said, the disruption always opens the best space for startups to grow. So it's exciting to see, especially the revolution that in Italy, from what I hear, is driven top down, which is very important. Like many of the times, unless there's a buy-in from the stakeholders, it is very difficult to change. So the good thing I can appreciate about Italian leadership is that they are like driving it from the forefront. So that's great to hear. As a CIO, of course, one of the things that would be like the top two things on mind of a CIO today is security. So I can't escape but ask about the security aspects, Marco. That I'd say your take on security and some of the things that you are always making sure, because when you are taking decisions, you probably have to always think about, does that keeps my system safe or not? Does that increases or decreases my risk? So what are the things as a CIO that come to mind, in terms of security measures that you are taking and the future of security?
Well, these are hard times for cybersecurity in the sense that after COVID, we've had an explosion of cybersecurity threats and attacks, regardless of the fact that we were investing or not. It just exploded. And in Italy, the healthcare sector is now the second sector in terms of number of attacks overall. So we are a major target. And this was a starting point. On this, we basically built, designed a general program like the Recovery and Resilience Program that is basically destroying and rebuilding everything. And these are the worst times, because when you build, extend, and start extending beyond the hospital, your digital infrastructure, these are the worst times in terms of security, in the sense that, of course, you are more fragile because you are concentrating on other aspects and not strictly on cybersecurity. We had built a cybersecurity project, a cybersecurity paradigm for the hospital in the last 10 years, and suddenly we have to review it completely, because we're going beyond the hospital. We're changing all the different subsystems because we are renewing them. So it's the perfect time to be attacked, actually, in a sense. At the same time, though, we have the opportunity to actually invest in cybersecurity, because part of the funding coming from the program, from the national program, is devoted to actually cybersecurity. So these are the best times actually to start rethinking about your cybersecurity strategy and actually getting the right tools and getting the right changes in the organization. Nevertheless, any time of change is really the worst time in terms of cybersecurity, in the sense that you're more fragile. So these are hard times, and we hope to get through them, but there are also the opportunity times where you can start rethinking on a larger scale about cybersecurity, because all our cybersecurity approach in the last 10 years was retrofitting, reverse engineering of our architectures to fit cybersecurity here and there where possible. Now it's actually an opportunity to actually redesign the cybersecurity strategy from scratch. So it's a great opportunity. Scary, but a great opportunity.
Right, right. No, true that. And how do you see the advent of AI in the hospital systems? I mean, of course, no guess is that, the new age solutions would use AI, to operate efficiently, to create more value and so on. But I want to really know a CIO's perspective on, when you assess AI solutions, on when you look at the future of using AI into a hospital system. How do you perceive that? And how do you see, like those use cases where it is useful, where we should avoid it, where let's wait and watch. So what's your vision?
Well, we're of course really literally flooded by offers of different types of AI
Everybody
solutions.
claiming. Yeah.
Everybody just would love to have their AI solution implemented in one of our organizations, especially in our case, we have a research institute in oncology. Therefore, we have several companies that actually would love to have their solutions implemented in our environment. The thing is that you can broadly classify the AI solutions into two different categories. One is clinical decision support systems, mainly aimed at diagnostic or even therapeutic processes. Those are the nice and fancy ones. I love them. Coming from a university environment myself, I've been a researcher. I love the idea of systems that actually help the diagnostic process and improve the quality of the diagnostic process. Nevertheless, seeing the system as a whole, there's a lot more value in the second type of AI systems, which are the process optimization AI systems. Those AI systems that not look at the single case, at helping the specific patient, but rather helping the organization remanage their workflows in a way that is more optimized and more efficient. Just to give you an example, having an AI system that within the emergency department schedules dynamically the radiology examination and all the workflow within the emergency department in order to make it more efficient and get an overall gain. It's not as fancy as having the system that interprets the image and does all fancy stuff. It's not as that impressive, but nevertheless, the value is a lot more in this specific era, in this specific time frame. We are in great suffering in terms of resources, medical and nurses. And we are flooded by a huge amount of patients and different kinds of pathologies and chronic pathologies increasing. So our emergency right now is not really getting better at the diagnostic process, is getting better at organizing our resources. In the sense that if we have AI systems that improve our efficiency 10% in terms of managing emergency department patients or oncology patients or chronic patients, that's a lot more value than actually improving the diagnostic process. They're both extremely valuable, but in this specific time, what we would probably invest a lot more is AI systems that improve processes, that improve the workflows, that improve our overall efficiency, improve our productivity overall as a healthcare organization, because that's a real emergency right now.
Right, very well said. A follow-up question: does Italian healthcare system also faces problems around staff burnout and staff turnover and shortage, etc., just like what we hear more in the US country?
That's a worldwide issue, actually. We have all these issues. We have very few doctors, especially in specific types of disciplines like emergency department, anesthesiology, and other increasing areas that are in deep shortage. We have a shortage of nurses. Actually, Italy is in great trouble because unlike other countries that have invested in the professional role of nurses and other non-medical, non-doctor professionals, we have invested very little. Therefore, we do not only have a shortage in doctors, we also have a shortage in nurses, and the combination of two is terrible. And also, of course, this brings to burnout, because the two things are related, of course. So when you have burnout, the effects on the digital strategy is, of course, that you have to focus on burnout and the resources optimization. Your EMR has to focus these areas. There's no way around it. And every project that you implement in terms of digital change will be so hard, a lot harder than it used to be in the past. When we implemented the first EMR systems, in a way, of course, there has been resistance in the past, because that's part of human nature, resisting change. But in a way, they were enthusiastic about the fact about the new possibilities and getting all these new fancy ways of managing information and helping their patients. Now it's a lot harder because every change it sits upon the fact that they are suffering in terms of burnout, in terms of lack of resources, frustration in the fact that they cannot cure the patients as they would love to, as they were used to be in the past. Therefore, when you try to impose in a way a change in terms of digital infrastructure, okay, we are changing your EMR systems because the new system is nicer, it pumps up information to the new fancy national electronic health record. It's very hard to convince them because these are hard times. They would simply love not to have any further change because they're struggling on an everyday basis on their everyday life. Therefore, having also these new digital changes really is hard, and it's very hard also in terms of psychology to get the messages like we are implementing this new system because it will help you on the mid to long term in managing your resources.
Right.
You have to focus on the short term also because otherwise their suffering really brings a rejection of any change.
Right, right. No, I can imagine definitely. And the staff being one of the most important stakeholder, and for them, technology may not be something that they may think on day like as they start their day. When they start their day, things that would be on their mind would be patience, and how do you manage that conflict? Great. Thank you so much, Marco. I think this has been a very exciting discussion, plenty of learnings, and we appreciate, the way you explained and the openness that you shared with the whole healthcare ecosystem of Italy. Thank you so much. We appreciate it, and
Thank you.
we wish you all the best with the endeavors that you are looking to build in the hospitals and with all the future initiatives. Thank you so much.
Thank you.
Thank you for joining us on the Health Tech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.